Today's water is not your ancestors' water. All these chemicals, these toxins, making the water acidic. Acidic water makes you inflame, your gut inflamed, your joints inflamed.
Water flushes and cleans your body. And because we live in a chemical wasteland, because everything's on our skin, because of our food being so dirty, because of the dirty air, everything we come in contact with, you have to flush that out more, which means you need more water to do that.
Neck pain, backaches, headaches, fatigue, the list goes on, and you're likely on it. Tired of the broken system and big pharma? We offer logical solutions, teach you to think critically, and empower you to reclaim your health. Welcome to the Unplugged Healthcast with Dr. Kevin Wall.
Hey, welcome back to the Unplugged Healthcast. This is Dr. Wall, your host. I have spoken many times over the last 30 podcasts about the simplicity of health. And I just believe health is more simple than we make it out to be. I say food, water, and sunlight is what you would give to plants if you wanted them to be healthy. The right amount of food, the right amount of sunlight, the right amount of water. Well, today we're going to talk about the right amount of water. Today our podcast is on water. Man, water has gotten a little complicated compared to the days of old. But to have that conversation today, I have invited in one of my favorite co-hosts. You may have seen and heard before, but Dr. Jenny Bush is back to hang out with us again. Dr. Jenny, it's good to have you.
Thanks for having me. I'm excited about this one.
What have you been up to?
Work, mom mode, just living the dream.
I heard you're doing a little consulting though.
Yes. We just launched. It's called Unplugged.
Yeah. If you're listening out there and you are struggling in a practice, needing help to get your practice to succeed, we are helping some physicians and health providers to be more successful in their health practices. And Dr. Jenny is leading the charge for us. Today, though, we're going to keep you in provider mode, maybe mom mode a little bit.
Yep.
And we're going to talk about water. I know that you're like me. You grew up in the Midwest. You grew up on the farm. For me, growing up on the farm, water was reasonably simple. I didn't drink that much of it, but we had wells. We had ponds. In our place, the well was 150 yards from our house. The pipes were rusted. The water we drank was red. It was a little weird. Water, was something you drank out of the hose. What was water when you grew up?
It was very, very similar. I mean, I grew up on a big cattle farm. We drank from the hose at the barn. Our house was the first house in the Northwest Territory built that had running water. So I have no idea how old those pipes were. It's a historical home. I can say the water, when I go back, it tastes a little funky. I wouldn't drink it now.
Wow. Yeah, it was strange. There was no filter. There was no filtration. There was no reverse osmosis. I mean, you drank literally out of the hose that I think you're feeding the cattle with.
Oh yeah, the same water.
Oh my goodness. Well, it is a different day. And I know right now you don't have any cows in the back today, do you, at the house?
Well, my brother has cows back on the farm, the same farm, but I don't have them in my Scottsdale home, no.
I hope he's getting some filtration in his water because it's a different world. All right. Well, here's some stats. A lot of you may or may not be confused or think water's a big topic. But if you're listening, you as a human are 61% water. If you have an infant, they are up to 75% water. 71% of our Earth's surface is covered with water. Out of that, 96.5% of it is salt water, which is really not probably drinkable. Although a lot of times people talk salt water is good for you. I don't know. We'll talk about that later. 3.5% of that is fresh water. And a lot of that is actually in the glaciers, they say, is frozen water that you really don't have to tap to. So our ecosystem is reliant on water. If you haven't noticed, water is something you're attracted to. You like to be around it. You like the sound of it. You want a fountain in your house, in your backyard. And you should be drinking a lot of it. And here's why. You think maybe water is optional or the amount of water doesn't matter. But there are so many physiological processes going on in your body that require the right amount of water. Let me just give you a list. Thermoregulation. Water helps maintain a stable body temperature, cooling you down through sweat. If you're living in Arizona, you need some thermoregulation. Would you agree?
Oh, 100%. We need a lot of water here.
A lot of water. Nutrient support, nutrient transport. It's a primary component of blood carrying vital nutrients and oxygen to cells and tissues throughout your body. If you don't have enough water, you don't get enough oxygen, you don't get enough nutrients passed throughout your body into your tissues. Waste removal. Water helps flush out waste products and toxins from your body through urine, sweat, and bowel movements. Listen to our last podcast on cows, constipation, and colonoscopy if you have questions about your constipation. Lubrication and cushioning. Boy, this is something we know a lot about.
Yep.
The joints in your body. There's a thing called imbibition. Tell us about water and your joints.
Well, I can say from just being a provider, you can tell the moment you start to work on someone that if they're dehydrated or not, because you just don't feel any mobility in their spine or any of the joints. It's just like stuck, like you're working through gravel. It is a feeling,
isn't it?
Yeah.
And it takes seconds to put our hands on people, and we can tell you if you're dehydrated, and most of you are.
Yep.
What percent of people do you think come in to our clinics, to your clinic, that really are just really low on water? Not just a little low, like really low.
Well, that's one of the first discussions we have with our patients. So they really start to they know because we're hounding them on it daily when they're in. But I would say 70%.
Yeah, I would agree.
Yep.
Your joints and your ligaments and your tendons are avascular, which means they don't actually have a blood supply. If you don't have enough water in your system, you will not get lubrication to the joints. The disc will dehydrate, the joints will dry up. You'll get arthritis as a result. You will not have proper range of motion. If you want to be active, if you want to play sports, I'm telling you, it's not just about water for drinking. It's about water for your back, for your joints, for your hips, your knees.
Yep.
It's huge. Cellular function. Every cell, tissue, and organ in your body require water to perform its functions properly. And there are a lot of functions going on in every part of your body, in every cell, and water is required. Metabolism, water serves as a medium for many biomechanical reactions, and it's essential for your metabolism. Digestion, it plays a crucial role in your digestion. So wow, when people say, I don't drink much water, or I'm not thirsty, what are your thoughts on that?
I mean, immediately I want to say, well, you're not living.
You can't really live normally.
No.
You're living a sub level of function in life and vitality and energy. I mean, all those things are affected.
Yeah, the moment you start to feel dehydrated, you're way past where your body should be with hydration. And you're going to be sluggish. You're going to be sore. You're going to be stiff. You're going to have brain fog because, like you just said, water is a component to every key aspect of your life.
Well, a lot of people say, I'm just not thirsty. I drink water only when I'm thirsty. Is that okay?
No, when you're thirsty, that's your body telling you needed water prior. It's like your spidey senses are going off. Like you're thirsty because you've dehydrated me. So
they're past the point of normal. They're in a crisis when they're actually feeling
and that's why
thirsty.
they feel thirsty.
I know by the prioritization of how your body actually uses priorities to determine where it's going to get its water from. The first area it goes to is your muscles, then it goes to your ligaments, tendons, then it goes to your organs, and the last area it goes to is your brain or your neurologic tissue. So I see a lot of people say, well, I know if I'm dehydrated because I get a headache.
Yep.
Isn't that like the last stage of dehydration?
Oh, that's by far the last stage. And you can even see this with sports and sports fatigue, especially in Arizona, because you're playing outside most of the time. So the students or the kids that are playing, they start to get like brain fog or they forget what they're doing. And that's usually their last level of dehydration. They were already stiff and sore during the game.
Well, what about Gatorade? I see a lot of people drinking Gatorade or these drinks that, they feel, well, I'm drinking a couple Diet Cokes, a couple Gatorades, and that's where I'm getting my water.
So that's fluid, right? They're putting fluid in their body. Unfortunately, that fluid is full of chemicals and really horrible sugar, which actually dehydrates you more. So no, that's not water. That doesn't help you with hydration.
That's a great point. Fluid is not water. I think people get confused. Now, when you grew up, I think you told me you didn't really drink much water. Why is water so vital now?
Water is, well, I always have to laugh because I have a big practice full of kids, and there's always left water bottles in the office because a mom, the first thing they say is, do you have your water bottle with you to go everywhere? And I've never had a water bottle when I was little.
No, no one did.
We
No one
drank.
talked about it.
Yeah, we had a water break at school, and I think it was 1 or 2 times a day, and you'd go to the
Yeah, the little
water fountain.
little dribbler, or what do they call that thing?
Yeah.
Bubbler, and you did drink, and everybody put their mouth on the same spot that the 25 kids before them did.
So gross, but and you'd get like maybe a tablespoon or 2 of water.
Yeah.
But that was sufficient because of the difference in the chemical exposures we had then and we have now.
So really the truth is drinking less water, maybe if you're older and you grew up and you didn't drink much water and you survived it, I get it. But that doesn't mean you're living in the same environment today that you grew up in. Is that what you're saying?
I mean, that's the most important part behind water. And it is more complicated because water is way more dirty now. We'll get into that. Water flushes and cleans your body. And because we live in a chemical wasteland, because everything's on our skin, because of our food being so dirty, because of the dirty air, everything we come in contact with, you have to flush that out more, which means you need more water to do that.
So right there is almost the biggest reason. If you question needing more water, it's not so much about that your physiology is that much different than years ago, but the environment you're living in is different. And this is one way to combat the toxins, the pollutants, the chemicals that we see and we drink and we smell and we hear. Everything that we're getting every day, water is a great way of dealing with that. Back to the Gatorade thing and the diet drinks. I know that a lot of people drink a lot of drinks that have caffeine, and they're using that to count for fluids or water. But there's almost a negative thing going on, isn't there, with the diuretic called caffeine?
It will flush your water molecules more out of you. So you're going to urinate more. So it's just going to cause you to have to drink more to replenish your blood and your CSF, which is cerebrospinal fluid. So to replenish the hydration in your body, it's not as dirty as like drinking a diet soda with aspartame in it than like a coffee, but it still is going to dehydrate you over time.
So caffeine is a diuretic, as we just said, and what it does is it actually makes you eliminate fluids. So if you're drinking that, you almost got to compensate by doubling up with water for how much fluid you drank with caffeine. That was my rule that I told everybody.
Yeah, if I have 2 cups of coffee, I then need a lot more water.
So 4 cups of water then, just to kind of combat or to get back to somewhat
equilibrium
normal or neutral. You know, you hit something there that I don't think a lot of people maybe understood is you have a thing called cerebrospinal fluid. This is the fluid that surrounds your spine, surrounds your brain, and it's vital. It's bringing nutrients to your brain. It's huge for normal brain function, neurologic function, back function. And a lot of our patients, you know, they don't realize when we see you're dehydrated, it's not just about your muscles. It's actually about your nervous system is being hindered. It's being hampered. It's not getting proper nutrition. And some of the simplest things you can do is just drink water.
Yeah, drink water and movement. Those are the biggest things, especially for cerebrospinal fluid.
I got to tell one more story, then we probably better bring some value to these folks with some real actual science and recommendations. But I had my wife's Uncle George, loved Uncle George, the Greeks, Uncle George Kokoris. And Uncle George was a guy about 112 pounds soaking wet. He was bone skinny through the time period that I've known him, which was about 25 years. And in 25 years, he literally said, I never drink water. And he wasn't lying. He never drinks a glass of water. He only drank coffee, and he drank a lot of coffee. Well, George lived to be like 75, but by about age 55, George had diabetes, severe anxiety, multiple sclerosis, and severe muscle atrophies on top of some other health conditions that I don't want to spend time going over. And you just couldn't get him to understand that it was probably the fact that you just never drank water.
I mean, that's what layered upon layered upon
It's
layered
almost what
all
you'd
of it.
expect, wouldn't it?
Oh, 100%. I mean, he might have lived till 75, but he didn't live good. He didn't
Such
have a great life.
guy, but he was just full of fear and all kinds of health issues and lived in assisted living for the last 10 years of his life at a very young age. Either way, I'm hoping that we can stress to you, if you're listening to this thing, we're not trying to, make George feel bad. We're trying to make you feel better. Understanding one of the simplest things you can do is drink water. But here we go. I get water has become very complicated. Holy mackerel, there is a lot of options out there that you can choose from. So let's discuss water, Dr. Jenny. And I know you have kind of researched the backstory of a lot of these options out there, from filtered to RO to ionized to hydrogen water. Let's just start simple. What do people need to know when they try to figure out what type of water to drink?
Okay, so I want to preface that I'm not a water expert on like the chemical reactions of water, but I want to say I'm an expert on clean water. And the reason for that is I have a medically complex son, and we were told he would pass away. And I was like, no, I'm going to figure out everything. And I wanted to give him the most chemical free life as possible. And I knew that was important so that he could, at least hit milestones as much as possible and be as healthy as possible. Hence organic food. But water was a really, really, really big component when I've talked to the most influential doctors, and then the research I did on having it clean for his body. Lucas has, extremely, extremely rare genetic disease, and his motor skills, he's 4 years old and still can only roll on the floor. So he's very limited in motor movement. And I know that movement's the key to life. Water is a huge component to that. And at first he struggled with constipation. He's never had anything in his body that's not organic and clean, like the cleanest food. And we were giving him what I thought was clean water. And then I started doing a lot of research, and it wasn't clean enough. So I can go a little deeper.
Well, let's do that. We're going to finish with that story a little bit. If you don't mind me asking, though, because I know a little bit, just enough to kind of be on the periphery of Lucas, but how long did they expect him to live?
We've been told he'll only live up to 7 years.
Okay.
Yeah.
But he's doing great right now. For everything they've told him and limits they said he would never get to, he's exceeded all of those.
He has exceeded all of them, yes.
So this is relevant to her son, but it's really just relevant to you in everyday living healthy lives, living vital lives, and living life, through your latter years. Let's just start with some of the simple things. What are your thoughts of just drinking water straight out of the tap at typical, let's go Phoenix or small town America?
Don't do it.
Don't do it.
No.
Tell them why, though.
Okay, I've become a water snob. So we can say that instead of a water expert.
Okay.
Because our tap water is so dirty now. It has so many different chemicals than it used to have, especially fluoride, which is going to be a controversial conversation. But fluoride in high doses, high amounts, which we're drinking more water now, so we're getting higher doses than we used to, is a neurotoxin, can cause tooth decay, even though they tell you it helps without tooth decay. Well, not in higher doses, like I said. Causes bone issues, so many things. It's linked to multiple sclerosis. So tap water, there's too many chemicals in it. It is not real water.
Okay. I think people probably get a grasp for that. I don't think that's startling to people, but then a lot of people buy these filters, or they put them in the fridge, or they just pour water through those.
Yep.
What do you think of those filtered water filters?
They really don't clean the water enough.
They don't?
No,
Are they getting the fluoride or any of that stuff out?
Yeah, no, it is still in there. Maybe a little less, but it's still very dirty and chemically filled.
So it's really just a waste of money. Even though they're less costly, they're still just probably not worth what you're spending.
I would say it helps if you're cleaning your vegetables and it does help.
So maybe those water filters are good for things other than consumption.
Not drinking water.
Okay.
Yep.
What about water filtration for people's washing machines and things like that? Is that just going just extreme? Is that really relevant? I mean, why do I have to filter the water that's cleaning my clothes?
Well, it's not just cleaning your clothes. It's also cleaning your body in a bath and shower. Usually that's a whole water system. And I mean, like we said, the chemical wasteland, your skin absorbs all of that. That's what you're rubbing on it. So And then the
So
clothes,
even in a shower, people get in a shower, whatever's spraying on them, they're absorbing some of the chemicals in the
100%.
water.
Yeah, we have a water filtration system and then another one on the spigots
Wow.
just to even, decrease it even more. And then your clothes you wear all day long. So that's absorbing into your skin.
Okay. What about reverse osmosis? That's a better option, isn't it? What are your thoughts on that?
It's a better option. It's still not the best option, but it is better.
I've seen people drink distilled water or deionized water.
Okay.
What are your thoughts on that?
Distilled water is the cleanest water you can drink based on chemical exposures because they're boiling it and they're getting all the stuff out of it. Only tricky part with distilled water is it can dehydrate you some because of how the water molecule changes. So you'll want to add like salt or an electrolyte to it to help with the better absorption for your internal organs.
I had a friend, and I know her mom only drank that type of water because it helped her stomach. She felt better.
Yep.
But then she got severe osteoporosis. Do you think that's connected?
Yeah, it leaches from the bones. So like if you look at the only distilled water that you can buy like at the airport, because I'm always looking at the airport, I have to use their water because you can't take any in, would be Smart Water is what I buy. It's distilled, but they add the electrolytes back into it.
Really? That's
Yeah.
what smart water is. I didn't know
Yeah.
that.
Yep, it's distilled
Okay.
water with electrolytes.
So really, it's about the electrolytes or some of the trace minerals that you're missing when you do deionized or.
Yep,
or
you have to add that back in.
Gotta
Yeah.
add it in. Gotta have that. Gotta get
Yep.
that calcium.
But it is the
potassium.
cleanest.
Okay.
Yep.
Well, that I think brings in, a whole different area of, what I think they call functional water.
Yeah.
And this is kind of a new biohacking term, but it really is relevant. And what you're doing is taking water, which was literally something that existed, and we just took it for granted. And now it's actually something, a part of our healthcare system. It's part of what we do to treat conditions. Is that kind of what they're talking about with functional water?
Yeah, there's so many labs now that they can check with like your gut bacteria and just, your blood. So, and we know water is one of the nutrients you have to live, right? You can't live without water. So they figured out how to make water, let's say, quote unquote, better or cleaner for better absorption, which helps with the other
So
daily
it's supposed to
functions.
help them absorb the water because water could just go in and out, so to speak, and not really get bought into the cells.
Yeah, or
Like it gets to the kidneys, so they think they absorb it because they're peeing it out, but we're talking about cellular absorption.
exactly. Yep.
Okay, well, then they come up with electrolyte water. Well, this is a water that contains dissolved minerals like sodium, magnesium, potassium, and it carries an electrical charge. What do you think about that?
Well, that electrolyte water does help, but if it's still like a dirty, purified electrolyte water, it's not going to help you either.
What's the electrical charge got to do with anything?
It helps with how it attaches to the cell structure to be absorbed.
So again, back to the absorption things there.
Yep.
All right. Is there science behind this stuff? You think that really shows that electrical water works?
Well, there's science behind everything that wants to be
Wow,
sold.
it's so hard to know what to follow and what to believe.
I can just tell you, you have to go with the cleanest water possible. And all the electrolyte waters aren't clean.
Okay. So I
Don't
think we'd
drink
probably
purified
say
water.
stay away from most of those.
I think so.
Okay, what about this one? Himalayan salt water, which is a common thing. And we've even done that in our clinics where we advise people that they should add a little sea salt or Himalayan mountain, the pink salt into their water. Why would people do that?
To help with the absorbability again. Salt helps you absorb your water into your cell structure.
So I know when I played football, when I'd get cramps, they'd give us salt tablets.
Yep.
Is that why they did that?
Yep, because it absorbs and goes straight to the muscle first, like you said earlier.
Okay, so it's all about absorption, and that's why Himalayan sea salt. So if someone's going to drink Himalayan salt water, how much should they drink? Is it every time they drink water or just once a day or twice a day?
I don't have an exact answer for that. I would say like once a day should be plenty. But if you're super dehydrated, you're having muscle cramps, you might need 2. My rule of thumb is a pinch in the morning into your first bottle of water, and
Okay,
that's
so it's
enough.
not every time they drink water, not every bottle. So once a day, a good pinch. And
Yes.
get that
and
salt in
and
there.
it depends on how much water you drink and like how hydrated your body is regularly.
Well, can they just use normal table iodized salt?
I don't think so.
I don't think so either.
No.
The iodine connected to the salt
Yeah.
changes the whole scenario. That's why you have to use, that's why these natural salts are so popular today, is because table salt typically is what they call iodized salt. And it just doesn't act the same and doesn't absorb the same. And your body can't, in fact, it's got to break the iodine molecule off of it just to actually get use of it. And honestly, you got to remember that came back in the 40s and 50s when people were having goiters back in the Midwest because they never got enough salt.
Yep.
I'm sorry, not enough iodine. So they attached iodine to your salt just to prevent thyroid conditions. It's kind of a crazy way to go about that.
Yep. And what's ironic now is dehydration and a lot of the waters with the high levels of fluoride cause goiters and thyroid issues.
There we go.
So like
Just
reversed.
turn it full circle.
Yeah.
All right. Well, here we are. The last couple of big ones that I know that are popular today and kind of out there is biohacking solutions are alkaline water, trying to get the pH in water to change. Can you, like, what is normal pH in normal water? I always kind of thought it was just neutral anyway, but if it wasn't not neutral,
Well,
any idea where it sits normally?
water should be neutral, but I think because they do all these chemical processes to it and have everything added in, that's what causes the acidic nature of it. So then we try to go the complete full circle other way with alkaline water, which is good, but most alkaline waters are still purified. They just put more nutrients in it of like the potassiums and all the electrolytes.
Okay. So really what the need for that comes from what we started the show off with is today's water is not your ancestors' water. All these chemicals, these toxins making the water acidic, correct?
Yep, acidic
and acidic water makes you inflame, your gut inflamed, your joints inflamed. So acid, you can picture swimming in a swimming pool in acidy water. When you come out, your skin is all red. Well, that's the same type of stuff when you're just drinking tap water that's on the acidic scale. Remember, neutral is 7.0.
Yep.
And if you are acidic, you are below 7, correct?
Yep.
And so you want your water to be alkaline, which is what they're trying to do when they sell this alkaline water.
Correct.
And by doing that, they say it reduces inflammation. Do you really believe that's true?
I think it could reduce some inflammation, but I like I said, the water still isn't as clean in most alkaline waters.
So I think what we're trying to do with that process is really not maybe trying to fix something more than just try to get back to neutral.
Yeah.
And that would be the benefit. So you would say, try some alkaline water. It's surely better, but not to get the trace minerals in it. Are they automatically putting the trace minerals in it?
They do put the trace minerals in it, but like if you're choosing, you choose alkaline water before purified water. But you choose spring water before you choose alkaline water.
Okay, hold on. You lost me there. Spring water is...
Spring water is cleaner. Most spring waters are cleaner than purified water. Most alkaline waters are still purified water. They just add the electrolytes. Purified water is the dirtiest.
Goodness, it is complicated, isn't it? And that's why we're doing this podcast, just trying to give you some clarity, unplug you from this matrix and get you to understand that. I think the summation of so far of what we came up with is you need water. I don't think anyone's arguing that to be healthy, to have physiological responses and everything working correctly inside your system, including your brain and nervous system. But there are different variations, and some of the money spent is maybe worth spending. Is that true?
If I'm choosing one thing for our family, we're choosing the best water.
All right. Well, tell us what it is.
Okay, so we drink hydrogen water, which the brand we use is Hydor, which is local. So that's
hydrogen water. It's the new rave.
It is the new. I mean, Gary Brecka blew it, out on the internet. He pretty much has everybody talking about it in a good and bad way.
Well, let's do this.
Yeah.
Let's watch a quick little video that actually has good and bad in it, and then we'll see what you have to say on the hydrogen water maybe concept. It seems to be controversial in some circles.
Hydrogen water is the best water you can put in the human body. That little thing that I gave you right there, that little thing, you pour your spring water in there and you hit that little button and it adds hydrogen ions.
This charlatan can't even get his buzzwords right. If we remember back to grade school chemistry, when you put hydrogen ions in solution, you create the definition of a Bronsted acid. However, a further inspection of their page says that they claim to use electrolysis to split water into hydrogen and oxygen. That is hydrogen gas, which is a molecule, not an ion.
It feeds a whole class of bacteria in your gut called hydrophiles.
There's no such thing as a hydrophile bacteria. Having higher circulating hydrogen concentration in your gut fluid can reduce the production of butyrate, provided that you're eating a crap load of bread like an idiot.
Occurs naturally in streams that are running in nature.
Don't fall for this grift. Drink more water.
Okay, well, Gary definitely has a high opinion of hydrogen water. In my world, the jury's out. I'm not quite sure exactly of what it does. I understand the possibility, but wow, this guy, he's got a strong opinion of why Gary is a charlatan, I guess.
Yes, it's very impressive, his vocabulary, for sure.
He doesn't look, he looks more like the charlatan than Gary does, but what did he say that had any relevance? And then expand on why hydrogen water is something you believe people should consider.
I mean, I'm not an expert in the water molecules and how hydrogen water works, but I can tell you from experience, and it's funny he brought up exactly the experience that I've had with my son Lucas that we talked about earlier. We started giving him hydrogen water about a year ago. Within 2 days, he was no longer constipated, and that's a huge issue for kids with cerebral palsy or motor dysfunction is they don't move enough, so their bowels and just their entire intestinal mobility is decreased because they're not moving. So within 2 days, he's not constipated.
Amazing.
It was amazing.
Well, was it relevant to that butyrate? He says that this stuff, reducing butyrate, is irrelevant. It's only with people who eat a ton of bread, which, by the way, is most of America. But
so that means most of America probably has high levels of butyrate.
Right. That's why hydrogen would be helpful to most people right off the bat. So he seems like he's kind of contradicting himself at the same time helping Gary.
Well, it's just so ironic that he brought that up because our little guy Lucas, we've had all the blood tests done and checked all of his gut bacteria. The only one that was abnormal was his butyrate level. And after a year of the hydrogen water, it's normal. Wow. So we know it helps.
Does he eat a lot of bread?
Lucas has never had bread in his life.
Well, this guy doesn't seem like maybe he's quite as scientifically based as he thinks he is. What about the hydrophiles? That was another thing he said. And I think in general, what I understand is hydrogen water helps reduce some of the bad bacteria in your gut. But this guy says no.
Well, I think he was just playing with words. When Gary Brecka described hydrophiles, he was talking about hydrophilic bacteria, which is bacteria in your gut that likes water, is attracted to water, and it helps with intestinal mobility. I don't think Gary Brecka said that there's a hydrophile bacteria. He said there are classes of hydrophile bacteria, which means they're hydrophilic. They like water in nature. So that guy was just throwing words around to be controversial, which is unfortunately.
Which is fun. But that was a really popular video, and I can see why people like controversy. And there is controversy when it comes to this because, I'm a little skeptical myself on hydrogen water. I'm not sure exactly, but a good friend of mine, he's a huge advocate as well as you. He says the same things you do. He's seen the benefits, and he has a machine that creates hydrogen water, and he tests it. Well, so if you're wondering out there and you're thinking about hydrogen water, I think it's worth a shot, especially it seems like if you're having inflammation and or even constipation or gut issues.
I mean, it's changed our home life. And like I said, if I had to choose between the one thing I was spending my money on for my family to have the healthiest life possible, it would be water. No doubt there would be nothing else that the water choice would be it.
Yeah, a lot of times we spend a lot of money on vitamins and nutrients and even just kind of fad ideas. But I think the concept of water has been around for a long time, and it's going to be around for a lot longer. And that would be really the emphasis of this podcast. Back to how I started it, food, water, and sunlight in the right proportions makes healthy plants. And in the same breath, the right amount of correct, healthy, clean water is vital for you if you want to be a healthy fern. Dr. Jenny, last parting words of wisdom for them.
Yeah, there's so many options. So I'm going to list the cleanest we'll list the dirtiest to the cleanest. And my recommendations: purified's the dirtiest. Don't drink purified water. Next, you want to go to spring water or the alkaline waters. But remember, alkaline water is usually a purified water. Then you're going to want to go to a distilled water, but make sure it has electrolytes in it. And then just my favorite's hydrogen water because we've seen such a difference with our family.
All right. Well, there you go. There's a paradigm for you to consider and something to change. But the one guarantee to get the same results is to change nothing. So we just encourage you to take some of these concepts, these ideas, apply them to your life, implement them, try them out, but give yourself like 6 months. Don't try them out for 6 days. You won't see a difference. Try them out for 6 months. Give them to your kids. See what you get out of it. Either way, we got to sign off and end this episode. And this is Dr. Wall and Dr. Jenny Bush. We're signing off for today. We'll see you again on the next episode. Always remember, be blessed, be healthy, and never give up and never give in, and go get yourself some good water. We'll see you again in the next episode.
The information provided in this podcast is for general knowledge and informational purposes only. It does not constitute medical advice. Always consult with a qualified healthcare professional for diagnosis and treatment of any medical condition. The views and opinions expressed by guests are their own and do not necessarily reflect the views of the Unplugged Healthcast or Dr. Wall.